Good day, ladies and gentlemen. Thank you so much for choosing Equinoxe Radio Multimedia to get yourself informed on health-related matters. Cameroon, like many other low and middle-income countries, experience a high rate of childhood cancer. Though about 80% of these children suffering with childhood cancer survive in high-income countries, just 10 to 20% of these children in low-income countries survive. What accounts for this high fatality rate? That's what our guest will be answering today. But before letting the cat out of the bag, let's welcome my co-host, Asia Luciliengo. It's a pleasure having you on the program.
Always a pleasure, Immaculate. For good afternoon to our listeners and viewers out there.
Now, my guest is already seated close to me. Her name is Dr. KIFEM Vincentia, a Pediatric-Hemato-Oncologist at the Muntengene Baptist Hospital. It's a pleasure having you on the program today.
Hi, Immaculate. Good afternoon. Good afternoon, Lucy.
Good afternoon, Doctor.
Thank you for having me. Good afternoon to our televiewers and all the listeners of Equinoxe.
We are so delighted to have you on the program. Of course, Lucy,
sure, it's a pleasure.
So,
we are honored.
Lucy, we are going to be focusing on something that is very delicate. We are talking about cancer, and we know how delicate cancer can look like. So, back to you, Dr. KIFEM, who would like to know, what is childhood cancer all about, and which age group is most affected?
Okay, so thank you again for having me at Equinoxe Television to talk about this very important aspect of child care, which is childhood cancer. So when we talk about cancer, it is abnormal proliferation or division of cells in the body. So our body is made up of cells, and it's these cells that join together to form a human being. And these cells, they undergo what we call cell division and multiplication under a certain control. So there's a control that tells the body to form this number of cells. You are going to live for this length of time. You divide like this. But in the situation of cancer, there's a certain cell that becomes stubborn and doesn't follow this command. And so it just divides abnormally without following the command. So it divides and they occupy the space that is supposed to be occupied by other cells. So this process can happen anywhere in the body. It can happen at the level of our brain, in the breast, in the kidneys, in the bone, in the liver, and we have cancer in these various sites. And talking about childhood cancer, it's all the cancers that occur in children 0 to 19 years of age. And we have various types of cancers that occur in children. So basically, that's how cancer happens.
Let's now look at the types as you just mentioned.
Okay, so looking at the types of cancers in children, we have different types, so many types of cancers in children. And the cancers are grouped into what we call solid tumors and then hematolymphoid tumors. So the hematolymphoid cancers are those that involve the blood and the lymphatic system. And then we have solid tumors. Those solid tumors, we have those that are in the nervous system, which we call intracranial solid tumors, and those out of the central nervous system, which we call extracranial tumors, solid tumors, yes. So for the intracranial tumors, there are so many of them. And then extracranial tumors, there are also many of them. So those solid tumors. So we have Wilms tumor, which is cancer of the kidney. We have retinoblastoma, which is cancer of the eye. We have cancer in the bone, cancer in the liver, which is called hepatoblastoma. And then for the hematolymphoid malignancies, now the commonest are lymphomas. And the commonest is Burkitt's lymphoma, which we commonly see in our setting, affects so many children. And then we have the leukemias, which are acute lymphoblastic leukemia and acute myeloid leukemias.
Wow.
So there are a long list of cancers.
The terms are just
the medical terms are
okay, Lucy?
Yeah, before we continue with the manifestations of this cancer, I would like to give out the numbers for those who want to join us on today's edition. We have 670-547049, 670-547049, or 656-622222. I repeat, 656-622222 at the end. And back to you, Doctor. We want to know some of the manifestations. How does this disease manifest in children?
Yeah, so I was listing the various types of cancers. We have some commonest one that we do have, like the four most common cancers that we have in children. We have the lymphomas, like Burkitt's lymphoma. They have leukemia, then the cancer of the kidney, which is called Wilms tumor, and then the one for the eye called retinoblastoma. Now look at the manifestations of cancer in children. This is going to depend on the type of cancer, and secondly, on the location of the cancer. So based on where it is located and the type, is going to show us the various signs and symptoms.
So can we focus on the one that mostly affects children in our country? How does it manifest?
So like I listed the various common cancers in children,
yes.
So I'm going to say, for example, if you have any lump or swelling on any side of the body, it can be in the eye. You have a child with an eye protruding. You can have a swelling at the level of the jaw, in the neck, or you can, some mothers, while bathing the child, they can realize that they are feeling something hard in the stomach. It can be a cancer that is growing there. So these are manifestations of most of the solid tumors that we have. So the abdominal mass, especially in Burkitt's lymphoma or in the Wilms tumor. Then another common way that cancer presents in children is when you have persistent fever. Children that have fever on and off, they take antibiotics, they don't get well, or they get well after 2 weeks, they are coming back to the hospital because of this recurrent fever. Can already be a manifestation of cancer. Or recurrent anemia, recurrent shortage of blood, they require frequent blood transfusions and so on. Yes, and so those are some of the manifestations for the leukemia. And then a child that has maybe cancer at the level of the central nervous system, it depends on the age group. For example, for very young children, a baby that was developing normally, maybe she was already able to hold things and move around, and suddenly you realize that the developmental milestones are regressing, can already be a sign that something is going wrong. And then you can have maybe weakness of one side of the body. That can also be a sign of a brain cancer. Or seizures is also another sign of brain cancer. And then with regards to cancer of the eye, yes, we call it retinoblastoma, which is one of the commonest cancers that we see in very young children, less than 2 years. They present with a white spot in the eye. You know, the iris is that small dark spot in our eye that we see, not the black area. There's another dark spot in the middle, which is called the iris. So in the case of retinoblastoma, that spot is going to be whitish. So it's an early manifestation of a sign of cancer in the eye. So we see that we need to seek medical attention when it's early. So we have many different ways that cancer manifests, but these are some of the common signs and symptoms that we see.
Now, when a child is facing all this, how can this be remedied at the level of the hospital?
So if we have a child presenting with these signs and symptoms of cancer, cancer care is a specialized kind of care, so it's done in specialized treatment centers. So these children should be referred to those treatment centers where we take care of children with cancer, so that they can be taken care of. We have various treatment modalities that we use depending on the type of cancer that you have, the site, and the grade. So can do what we call chemotherapy, which we administer medications, either IV or orally, to treat them. There are others we need to do chemotherapy and surgery requiring operation and so on. So the type of treatment is going to depend on the type of cancer.
And now, how does childhood cancer affect the development of a child?
With regards to the child's development and cancer, so cancer is an acute illness. So look at the child's development, it will not really affect it per se, but the psychological aspect of it, because these are children that are going to be in the hospital for long, requiring prolonged treatment. So it's very depressing for some of them. They don't have time to play with their mates or go to school.
We have a call on the line. We come back to that question. Hello?
Yeah, good afternoon.
Good afternoon. Your name, where you're calling from, and your question. Okay.
I'm following up with the health program that the doctor is lecturing.
Okay.
I got puzzled at this point where she said when the child frequents the hospital for transfusion of blood, is cancer. So I don't know the difference between this transfusion and a child who suffers from sickle cell. Thank you.
Okay. Doctor, you got the question.
Yeah, thank you very much, Glory, for that question. So I was looking at those, we call it warning signs of cancer in children. So there are many different kinds of diseases that present the same way like cancer. Like fever is not just because of cancer, we have other causes, same as anemia.
Yeah.
So when the patient presents, we look at the history, examine the child, and we are going to put all this together to help us to determine whether these symptoms are related to this sickle cell disease or this is cancer and so on. So there are ways that a child with sickle cell disease is going to present, and a child with cancer is also going to present in a different way. So it's based on our clinical evaluation
Diagnosis.
and the diagnosis and investigations that we are going to do. But when you have recurrent anemia, it should be an alert for us to investigate.
Is there a possibility that cancer can be hereditary?
When we talk about cancers in children, most of the causes, we don't really know the cause of cancer in children.
Okay.
And just very few cancers we can say that is hereditary or genetic. So more than 95% of cancers in children will not have any risk factor that is identified. So it's only maybe like this cancer I was saying of the eye, we call retinoblastoma. We have two types. We have what we call the sporadic type and then the familiar type. So the familiar type is the one that can be genetic, where if you have, maybe you are a parent that you suffered from retinoblastoma, you have a 45% chance of giving birth to a child who might develop retinoblastoma later. But apart from that, many other cancers, they just occur spontaneously. So there's no, most of them don't have any genetic link. Yes, to it.
And now, taking care of a child who is suffering from cancer might be very tedious, might be very challenging. What are some of the difficulties faced by parents whose children suffer from cancer?
Yeah, like you rightly said, it's really a great challenge. First of all, to hear that your child has cancer, and then what you need to go through to see this child through the treatment. So one major challenge that the parents face is financial constraints, because cancer care is very expensive and it's very hard for an average Cameroonian parents to be able to take care of a child with cancer. So they really face financial difficulties. It's not just a 1 week kind of treatment. It's treatment that's going to go on for months, and there are some that even go up to 2 years of treatment. And you have to be coming to the hospital every time to take these treatments, transportation. At times the children fall sick. It's not just about the chemotherapy itself. They need strong antibiotics when they have infection. They require recurrent blood transfusion. You need to transfuse them. So it's really costly. And some of them, when they start treatment because of this challenge, they end up abandoning the treatment on the way. And once you have started treatment and you abandon, it's as if not even starting at all. So that's some of the challenge that they face. And some of them also social issues. You have a child with cancer, it means that your work is affected. You have to, because being in the hospital at all times, some of them they can be dismissed even from their job site because they are getting absent every time to take care. And other younger children at home, which you need to take care. So require a lot of financial sacrifice, time-wise, and so on.
You made mention of that it is expensive. How much can it cost for a treatment?
So the cost of treatment is going to depend on the type of cancer and then the stage of the disease at presentation. Yes, because cancer is in stages. We have the early phase and advanced stage. But unfortunately, in our context, most of our patients present in advanced phase of disease, and advanced stage means more costly treatment, more toxic. But the cost of treatment can range from, let's say, 500,000 to up to $1 million or more. So it depends on the type of cancer.
So you got that amount. That's really
expensive.
Yeah, it's quite expensive.
So can we say that the treatment for children is more expensive than that of adults? Because I heard somewhere that taking care of an adult with chemotherapy is about 350,000 francs CFA. So that of children, is it more expensive, or like you mentioned, it depends on the case?
As I said, it depends on the type of cancer and then the stage and the type of treatment that the patient is going to require. Because there are others that take only chemotherapy alone, others who have chemotherapy plus surgery, others will require chemotherapy, surgery, radiotherapy, and so on. So averagely is that amount, right? From that 400 or 500,000 to more, but it can be less or far more than what I said, but it's just an estimate of what you can spend.
So, doctor, you made mention of the challenges faced by parents. We also have health workers who are also being faced with some of these challenges. What are their own difficulties?
Yeah. So our own difficulties that we face, like I said before, is the problem of late presentation of our children. Because one good thing about cancer in children is that it's very curable. Yes, in high-income countries, like Immaculate said at our introduction, more than 80% survival in childhood cancers. But in our context, just 20 to 40%. And the major problem that we have is this problem of late presentation. And when they present late, it becomes difficult for us to treat. It is more costly. We have more toxicity, and the length of treatment too is also long. And so that's the first thing that we face. And also the fact that these children, they start treatment and abandon along the way. It is very discouraging for us, you know, when you see a child really want to save and you start treating, and then they have to abandon treatment along the way. I know that because of that, this child is not going to survive. Then we have problems of diagnosis in our country. We don't have all the facilities required for us to do our extensive diagnosis. In some cases where diagnosis becomes challenging, you might need to send a sample but from abroad to help you clarify what kind of cancer it is, and at times you have to use by your clinical judgment to decide on the treatment to give the patient, because how many people can afford to send a sample abroad for a test to be done, and the tests themselves are expensive. So those are some of the challenges that we face, as well as availability of cancer drugs is also a challenge. Yes, some at times, some of the medications may not be available, but fortunately, the majority of the cancers that we see in children, which is Burkitt's lymphoma and the leukemia and the rest, we do have the medications that we use in treating them. But when you require more extensive treatment, like maybe radiotherapy, for children, it becomes a challenge because we don't really have it, and many people cannot even afford.
Now, you earlier said there's a cure in developing countries, and you said there are no major causes of, doctors cannot really tell the exact causes of cancer. We'd like to know from you, the month of September is considered as the month of childhood cancer, where they create awareness. Can you tell us more about this month?
Yeah, so September is Childhood Cancer Awareness Month, and we have the gold ribbon, which is the International Childhood Cancer Awareness symbol, and that color gold signifies how precious children are to us. Yes, these children are very precious to us, all children, and then children with cancer, and also signifies the resilience of these children, what they go through to go through the treatment of cancer. So describe them as heroes, because it's like you're in a battle trying to fight the cancer and you need to survive. So during this month of September, we do sensitization on the warning signs of cancer to teach people on how to recognize the signs and symptoms of cancer so that we can identify them early, and we refer these children early. They have a greater chance of being cured from these cancers. So we go to media houses like here, we go to meeting groups, to the churches to sensitize, and also to hospitals to sensitize healthcare workers to be able to recognize these cancers and the appropriate place to refer them, as well as doing kind of fundraising to see how we can also support children with cancer, because as I said, it takes a village to treat a child with cancer. That's a saying, because for one family alone, it is difficult. So we need the support of the community. We need people to support these families to be able to go through this treatment. So that's how this month we want to create awareness about childhood cancer.
Now, just imagine a child of about 6 years old who's watching you at this moment and is suffering with childhood cancer for, let's say, about a year now, and that child is going through a lot of pain, a lot of crisis, what advice do you have for this child watching you at the moment?
So a child that is suffering from cancer, so I advise the parents to seek medical attention. Cancer is not witchcraft. Some people believe that it's caused by witchcraft. It is not witchcraft. I've described how it happens,
Yes.
and there is a cure for cancer, so it can be treated. Right here in Cameroon, we do have the services available, so you should seek medical attention so that this child can be saved.
Okay.
Lucy, any last word?
She has mentioned it already, because I was worried if at all a child can be cured, because that's our goal, making sure that the child recovers, of course. But she has mentioned, like she earlier said, it's important for us to visit the hospital. We should not shy away from the hospital, because that's where we have our cure. And sometimes we should not focus on traditional medicine, like she also
Witchcraft, exactly.
witchcraft and the rest, like she mentioned.
But Lucy, have you ever seen a child suffering with childhood cancer? Let's say, have you ever seen it? Have you ever seen a case of such?
Yeah, in hospitals I've seen
And
cases.
how does this person look like?
The child looks pale. Most of the time, the child looks pale. The child looks tired. In fact, when you see a child that is sick, you know from the physical look, you understand that this child is not feeling fine. But well, they always say after God we have doctors in the hospital. So we know that they are our gods on the
yes.
earth. Yeah,
That's true, Lucy. So thank you so much, Lucy, for participating in the
always
program.
a pleasure.
Thank you so much, Dr. KIFEM Vincentia. She is a Pediatric-Hemato-Oncologist at the Mutengene Baptist Hospital in the Southwest region. And that's it for this edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogo. I received technical assistance from Bertrand Bonzini and Jonathan Babula. Coming from us to you over there. Have a lovely day. Bye-bye for now.